today. So, as Kerry just said, a very warm welcome to our distinguished speakers, friends, and everybody joining us for this second day of the ICUDDR virtual conference today, 14th of July 2020. We're very glad to have you with us. My name is Dr. James Harvey. I'm with ICUDDR, and I'm honoured to be your moderator for this session. It's also a pleasure to be joined by my colleague, Olivia Woodrow, who will also be assisting with moderation. It's also a pleasure to have Kerry with us, and a huge thank you to Craig Chapman for providing technical support throughout the conference. I want to express my gratitude to our esteemed presenters today and welcome you all to this virtual session of the ICUDDR First Virtual Conference, which will focus on the vitally important subject of educating and promoting addiction science in a virtual world. Just going through some of the ground rules. As you'll see when you enter the session, your computer is automatically set on mute. We will ask that you keep your mute on until we adjourn to the breakout sessions. The format for the session will be as follows. We are going to begin with the panel presentation from Dr. Prapapun Chucharoen. We will then follow this with the breakout sessions about the topic presented. During the breakout sessions, we encourage everybody to share any related work that you've done in your region or university, and also discuss challenges and share questions that you have. Following the breakout session, we will reconvene in a larger group back in the main room, and we will report back on what was raised in the breakout groups to then discuss what we can all do as ICUDDR members to move this important work forward. The panel focus is on coping with COVID-19, domestic violence, after SUD treatment, and continuum of care. Dr. Prapapun Chucharoen will be presenting on continuum of care for people with SUDs during COVID-19. Dr. Prapapun Chucharoen is the Assistant Professor in Neuroscience at the Addiction Studies Program of the ASEAN Institute for Health Development, AIHD, also of the Addiction Studies Department at Mahidol University, Salaya, Thailand. She is also on the Board of Directors of the International Consortium of Universities for Drug Demand Reduction, ICUDDR, and is the Director of the Asia Pacific Regional Collaboration Center of ICUDDR. She's also a Commissioner with the Colombo Plan International Center for Certification and Education of Addiction Professionals, ICCE. Dr. Prapapun, welcome to the conference. You have the floor.
Okay, thank you. Swadika, thank you, James. Swadika. Good afternoon, friends, and good morning, a friend from the US. Very early morning for you. We have around 45 minutes. All right, James?
Correct.
45 minutes. All right. 45 minutes for 3 speakers. So let's start from about the continuum of care for the people with SUD during the COVID-19. So today I would like to talk around six issues about the definition, brief definition of SUD, what's like, and treatment challenge, 6 dimensions of continuum of care, state of recovery of continuum of care, list and protective factors for substance use disorder, continuum of care for people with drug use disorder during COVID-19. This is preliminary data of our research team in the northeast part of Thailand and Bangkok Metropolitan. We are collecting data for watching the new normal, or we looking for the new normal routine of the services after post-COVID-19 also. And next slide, as all of you know, the SUD is a chronic disease, relapse brain disease that is characterized by the compulsive drug seeking and use. There's a harmful consequence, all of us know, and it is very difficult disease to treatment because it is a chronic and normal relapse. And the next is the essential. This is the normal essential of SUD. It is long-lasting branching and uncontrollable compulsive drug seeking and use. This is the essence of the SUD. And next is the treatment. All of us know that the treatment is very, very difficult for SUD because we're looking for the appropriate care model, but until now it is more difficult because no single treatment is appropriate for everyone. We are facing the difficult. It is different in other disease that you can treat the course and then you can progress the treatment. Whereas this disease, we don't know the exactly cause, and so we cannot treat the cause. So this is the treatment, and right now we the model treatment we try to fix the client and the hospital base. It is not appropriate for the disease because the treatment is not the best option, but recovery is very important also. And this is the 6th dimension that I catch up from the SAM, the American Society of Addiction Medicine, that talk about the 6th dimension of the Continuum of Care. This is if you find out if you want to find out the treatment or optional treatment for this disease, we should start from the dimension 1 is the detoxification until recovery, and interesting in recovery and environment. This is the dimension that you can read in the detail in exam book version. And I found New Hampshire's on August 2016, New Hampshire's Substance Use Disorder Continuum of Care announced that this is the full scale, the cycle full scale of Continuum of Care for substance use disorder. It is very interesting because it is concerned the primary care. The primary care is very important also for this disease because you concern community-based and family-based also. Next slide is so the Continuum of Care can lead many positive outcomes such as more awareness and knowledge of SUD across all service level and staff, smoother transition between level of care, service that align closely with the end of the needs, more reliable care support, better patient outcome. This is from the New Hampshire Continuum of Care announcement on August 2016. It's very good, message. For if compare the short-term and long-term treatment of addiction, it is. I think the SUD, we're looking for the long-term treatment because the long-term is more benefit than short-term. The short-term is cannot sustain the abstinence. From the study, this is the study from the UNODC and the WHO. We found that if you put the treatment in the hospital bed, so or we call the short-term treatment. So the success rate is around 30%. If we provide long-term treatment, you can have the success rate is around 70%. So it is very interesting for long-term treatment. So we looking for the Continuum of Care in this disease. This is the basic of Continuum of Care. Is to explore the option and accessibility to serve the full range of needs by this with substance use disorder, and that appropriate placement and navigation through the Continuum is depending on assessment of any individual patient. The step of Continuum of Care, this is a step, start from detoxification, residential care, extended care, outpatient care, transition treatment, ongoing aftercare treatment. This is a step of Continuum of Care. And next, the Continuum of Care concerns the recovery. The The recovery, one of my friends that I met in the practicum place, Lawland William, you can access from his website, Lawland William consulting.com. He said recovery is a verb, not a noun, right? Recovery is a verb. All right, recovery is a verb. Recovery is a process, not an event. Yes, I agree. Most people who try to get clean fail. Recovery is difficult. In my idea, very difficult. Recovery is biopsychosocial, spiritual. Recovery is taking good care of yourself. This is the definition of recovery. He catch up and discussed with me 3 to 5 years ago because we're teaching about the recovery steps. So we discussed. And this is, I catch this message from the paper you said, the recovery is a continuum of process and experience through with individual, family, and community utilize internal and external resource to address drug dependence and substance use problem. This is the recovery. So from the framework, you see the WHO try to definition the recovery. The recovery is mean that the oriented system of care that compares all of dimension of person quality of life. This is the recovery concept. So the Continuum of Care have the five level. This is a paper from the ICM said if you're concerned about continuum of care and recovery, you should concern 5 levels. Start from the early intervention service, like I said on the circle. The circle start the detoxification is meant that early intervention, outpatient, intensive outpatient, resident, and medical managed intensive patient service. This is the Assam principle. And as you know, we are facing the COVID-19. So the COVID-19, everyone stay at home. This is drug rehab, aftercare, individual needs, self-setting as a home, testing term and go. This is the aftercare necessary. But I mentioned the self-setting. Home, it should be the self, but the family may influence. The family can provide an important and positive role in recovery, or family can sabotage recovery. Relapse affects the family in several ways, we know, and the nature of relapse trigger later problem. The nature of relapse, for example, you cannot control the strawberry abstinence, and the family member may be trigger relapse. This is the essence of the family influence, maybe positive, but maybe sabotage the recovery. This is the family. So we found the domestic violence in the family during COVID-19 because most of them didn't have the skill of the parent skill for coping, and most of them stay more than 1 month in the same place in home. So we found domestic violence. And this is a list and resilient factors for continuum of care that I try to post, compare risk factor and protective factors. The current physical, emotional, or personality trait, this is risk factor, whereas the protective factor is knowledge regarding risk associated with substance use. And another risk factor is inherent generic vulnerability, low self-esteem. The protective is negative attitude toward substance and substance use. Physiological disturbance, bonding to pro-social culture. This is I'm trying to compare risk factor and protective factor. Lack of peer refusal skill has has positive future plan. This is a compared which I catch from the research. So another sleep and resilience factor for continuum of care is a family member with a history of alcohol is a risk factor. And the protective factor is close family relationship, consistency of parenting. This is essential for the curriculum that we should focusing about the family relationship. For I think in UPC we have, but we didn't have about the recovery arrangement or recovery management. We will focus because I facing during COVID-19. We are looking for the recovery management. And other risk factor is family conflict, and protective factor sure is family members are nurturing, support each other. This is the risk and protective factors. So the evidence base of practice, the evidence practice for continuum of care, we trust in motivational enhancement therapy can help the clients. Cognitive behavioral therapy can support, and 12-step is help the client for quality of life and sobriety. This is the three options that we have in Thailand. Some of the key policies to curtail widespread of transmission of coronavirus during lockdown, self-isolation, but we try to watch the new case of domestic violence. In the Thai government, we announced lockdown and school closing since March, and most of the people stay home. And the domestic violence is not only in vulnerable family, but we found in may occur in the normal family too, because during COVID-19 we found not only vulnerable family, but we found domestic violence in family, in normal family. For example, physical abuse and verbal abuse we found in the normal family. But we have hotline. Sure, hotline is supporting domestic violence victims. But in Thailand, we found less cases and not much. We found a few cases of hotline. I'll tell you in the next slide. This slide I gonna show you because it catch up from the globe that China, first country which introduced lockdown and used hotline. Hotline is good for China, and the U.S. also, for example, in New York and Ohio is raising of the hotline. It is good, but in case of Thailand, the number of domestic violence normally reported from hotline, but we found actually lower cases. But in normal circumstances, domestic violence in Thailand are often reported by outside, such as teachers and friends who notice signs of abuse. It is not by the victim, the case. Everyone are forced to quarantine themselves in their home. The abuser might prevent them from reaching out. This is the cause of the actually lower case during COVID-19 of Thailand, because we record the case from hotline only. It is not true, the number. And that is my brief about the definition of ICUDDR, the recovery definition of recovery, and the basic principle of continuum of care around the globe. And next is Dr. Chanchai will talk about the preliminary data that he recorded during COVID-19. Dr. Chanchai, the next presenter. Dr. Chanchai is medical doctor. He is director of Thanyarak Khonkaen. The Thanyarak Khonkaen Hospital is the main drug dependence center in northeastern part of Thailand, and it is very good practical place for our student and international student practice in his quality quality institution. Welcome, Dr. Chanchai. Please share your slide about the preliminary data and share your very good practical place. Please, Dr. Chanchai.
Okay. Thank you, Dr. Papapan. Good morning and good afternoon, everybody. I'm honored to share my data and my experience and pandemic of the COVID-19. So we start with the first slide. Today I will talk about how did the COVID-19 change the healthcare system and how do I handle this situation. Okay. 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 The COVID-19 significantly impacts health system services. Therefore, care process include emergency room, operation room, outpatient department, and dental clinic need to be changed, as well as drug addiction treatment too. Initially, we found that the patient who treat in the hospital have a different characteristic. There is a great proportion of the methamphetamine patient and adolescents are increased in proportion too. When focusing on methamphetamine in patients, there is a higher number of the patients with methamphetamine-induced psychosis. That's about 54%. And patients with aggressive behavior, we found about 30%. This finding impels us to develop more efficiency care covering to those two groups. I mean, during in the pandemic period. What do we do at the Thanyarak Khonkaen Hospital? We are develop clinical practice guidelines for methamphetamine. In the first step, we use serious mental illness with high risk to violence for screening and assessment. The second step, we control the behavior. If we found aggressive behavior, we will treat by medication such as antipsychotic drug and psychosocial intervention. And the last step, we monitoring about the side effect or adverse drug event of the antipsychotic drug that we use to be treat the patient. Okay. As for the screening in the patient with acute respiratory infection, the temperature screened by the thermal scan is checked in the screening point. High risk patient will be separate investigation at the ARI clinic. I mean about ARI is a acute respiratory infection clinic. Besides the check-in and the check-out registration via the Thai China application, that facilitates us to track the people who come to cross the contact with the infected people through the quarantine system. This slide show about in the inpatient unit, the inpatient unit are arranged following the social distancing. More isolation rooms are managed. We also consider the lower number of the patient participate in the group activity. And this slide, we show you about we prepare rehabilitation ward for staff quarantine that we call hospital from hospital plus hotel. We use this building. And in the last slide, we use the telecounseling for the patient in the aftercare process. And we have a drug delivery for the chronic psychiatric patients utilized for minimize hospital overcrowding. Moreover, we use teleconsulting by WebEx among the networking hospitals is proceeding in order to decrease the number of referral patients. And what is the next? We are looking for a possibility of the new normal. So I mean, today the world are full of volatility, uncertainty, ambiguity, and complexity that we call the VUCA world. So definitely we need some quick adaptation skills such as reframing the vision, understanding both inside and outside in the organization, and working clarity and agility. I mean, we can solve the problem by about the VUCA world by use VUCA to win them. In the last, how to cope this chaos requires change begin on yourself. Because if you doesn't change today, one day the world will force you to change yourself. Thank you, Dr. Papapan and others.
Thank you, Dr. Chanchai. The next, okay, we will discuss later in session breakout. James, could you help me to share the slide too? Yes, thanks. Next is Dr. Somchai. This is our country, Dr. Chanchai, representative from the northeast part of Thailand. His client came from Perth and neighbor country. Next presenter, he collected data from the Bangkok Metropolitan. Dr. Somchai, presenter, he is medical doctor. He is a director of the Bangkok Metropolitan. I can't remember your name. The Bureau of the Health Department, Bangkok Metropolitan, Bangkok. Okay, welcome, Dr. Somchai. Please, you have 10 to 15 minutes.
ผมใช้เวลาไปแค่5 นาทีกว่าบ้าง
Dr. Somchai, please.
เดี๋ยวเราฟังอันนี้จบแล้วเราจะออกครับ
No, Dr. Somchai, please. Dr. Chanchai, please mute the microphone, Dr. Chanchai. Next, Dr. Somchai is Dr. Dongchai. Yeah, Dr. Dongchai may represent. Yes, the slide is good. This is the slide of Dr. Somchai, but I didn't hear you, Dr. Somchai.
Can you hear me? Hello. Hi.
Okay, good. Good.
Yeah.
Yes, good. Okay, please speak close the microphone or your computer because the noise is not clear. Please.
Okay. Can you hear me now?
Yes.
Yes. Okay. Good
Yes.
afternoon, everybody. I'm Dr. Somchai, the Director of Office of Prevention and Treatment Department under Bangkok Metropolitan Administration. I'd like to talk into 3 areas. The first one is about the study of the treatment outcome spreading of coronavirus 19 under the Health Department. Okay, the slide is that the abstract. You can say that we can know that the situation of the coronavirus 19 is spread around the world, especially about the infected people rapidly. Everyone is at risk of getting COVID-19, especially for those who are using the drug, also the high risk of the getting for the COVID-19. Besides that, in the objective of the study, we like to do the effect of the drug treatment during the spread of coronavirus and of the Health Department in the Bangkok Metropolitan Administration. We do with the cross-sectional study between the December 19, 2019 to May 2020, and we do the data analysis, description statistics. The result is that we can find out before the COVID-19, the period is about 3 months, the correctional system was decreasing down 99.72%, and the compulsory system decreased about 56.58%. This means to say that the client during before the COVID-19, it is the amount of the patients is around 3,332 persons. During the March to May, for after the COVID-19, we can find out that the decreasing down of the patient is around 1,371. This means to say that, and then we clarify into that those who are voluntary decreasing down from 871 become 610 is not any change. But those who are compulsory 1,700 become 759, so that it becomes 56% decreasing down. And also those who are from the collectively from 713 become only 2%. This means to say that during the COVID-19, the crime in Bangkok are lower and decreasing down for admission. In this staging, I like to say that what we do, we also do the same as the criteria of the country as the Ministry of Health. We said that those who from the people who are affected to the COVID-19, we also do the same as in Khonkaen. For example, the people who come, we need to have the social distancing. We have to take out the temperature. We have to making some of the swab for the throat swab of the patient, of those who are admission or those who are visit us. And then after that, we will see that supposedly you are COVID-19, we will make you quarantine for 14 days. If you are positive, detected, we will send to the hospital. After the hospital will be admission for another 20 days. And after that, we send back to the community. For the community, we do with the home quarantine. The home quarantine here is the nurse and the doctor from the public health center are the ones who visit them. More or less the same as those people who are using drugs. We cannot visit them at home, but we do with the Line group and also Facebook to follow up, right? So we can know about what happening on this name. Do we have to do something? We have some problem. The staff, our staff, for example, psychologist, social worker, and also a nurse will be talk with them by the live group or the Facebook to be follow up for the criteria about the COVID-19. So in Bangkok itself, we can see that because of we are the outpatient, we are not inpatient. That's why during the COVID-19, we have very, very small of the amount of the patient to come into our clinic. Mostly, we follow them by the Facebook and Line, and we will give them some knowledge about what is the COVID-19 is, how to prevention is, what is the social distancing is, and supposed to be those who take the methadone, we will give them for take home methadone by the 5 days, 7 days with the document that we can follow up with those people who are using the methadone. That is what we do in the Bangkok Metropolitan Administration. So the suggestion is that for the COVID-19, it is a lesson learned for us that even though you are the drug abuser or not, or you are the chronic disease or not, or you are the outpatient or not, we can do the new guidelines for those people who need to be carrying on. I mean to say that the COVID-19 can show us that any kinds of diseases, even though you are a chronic disease or you are a drug abuse patient or not, we need to have the guideline with the specific guideline. So our staff will understand what to do. The patient will know what to do and how to follow up. We will know. Besides that, we also using the health volunteer to visit their home. It means to say that those clients, they live in the community, and the community itself, it will, what you call that, it will follow by the health volunteer. The health volunteer will be take notes and call to our staff about the following about the patient who have some problem with the COVID-19. That is what we do in Bangkok. That's all my presentation. Yeah.
Thank you.
I still have some more on detail about the drug addict in Bangkok because I'm a newcomer, so that I want to know what happened here. Okay. Still have minutes?
Yes.
มีเวลาไหมอาจารย์
Yes, sure.
Okay.
Sure. Okay.
I'd like to give you something about the drug addict in Bangkok. Actually, we are providing with the Bangkok Metropolitan. We have the 50 districts. In 50 districts here, we know that in Bangkok is a big city. It is a huge city because we have totally about 10 million of the people. The situation of Bangkok within 50 districts, we have totally around 30% of amount of the people in 76 cities in Thailand. It means to say that those people who are using the drug is more or less 1/3 of the country. We have totally about 30%. In 30% here, we can clarify that the highest of the using the drug in Bangkok is the ice of amphetamine, about 53%. And besides that is a methamphetamine, so around 48%. And besides that also we have heroin and also cannabis. What I'm going to say that I want to show you that nowadays, even though we know that the client using about the type of the drug, we need to know that what kinds of the drugs that they use, because we need to be catch up with the treatment and following up the patient, because of manage is more important for the looking forward after with the who are using the drug. So I want to show you that in last year, we can know that the number of drug users in Thailand overall, we have the name of 15 to 19 age group is the highest group, way back to 2015 to 2019. So we can see that mostly are the young generation. Secondly, are those who are work people about 20 to years old, and the last is about 25 to 29 years old. It's going to say that all of these ones are productive people. So during for the how to prevent them, I mean to say that we need to find out how to follow up with this kind of drug and substance prevention. We also doing with the community prevention, school prevention, factory prevention, and also with the community-based therapeutic rehabilitation. I think that when we're talking about this thing, we need to be talking about the whole system about drug prevention and also treatment. So prevention, what we do, we can use about EF together with the LEC, together with the life skill to let the people to understand how to prevent themselves. Next slide, please. Next slide, please. Go up to the narcotic clinic. Well, I'd like to show you that narcotic clinic, when we know that prevention is the most important, when prevention cannot be prevented, it will become to the treatment. The treatment, we have narcotic in Thailand and Bangkok, around 18 of the clinics for narcotics, and we have the 51 of public health centers to do with the outpatient with massive IOP. So we do running this thing for the preparation, detoxification, rehabilitation, and also for the narcotic clinic. Yeah, this is the activity what we do in our clinic. Next slide, please. Supposed to be you cannot prohibit it to become in the clinic. We also have rehabilitation center. What rehabilitation center here? We do with the 28 program days with the live program activity for the people who want to be admission for 28. This is the program what we do. We do with the program for the self-esteem with them for up with the 12 months. That is the activity for those people who are admission with our rehabilitation center. That's all what I want to share with you. Yeah, this is the showing information. Thank you.
Thank you. Thank you. Okay, thank you. Dr. James, could you return to my slide? Thank you. All right. Thank you. So, we will learn more about the Thanyarak Khonkaen. This is the main drug dependence center from northeastern part in Bangkok Metropolitan. In Thailand, we have the process of treatment is a 4 phase of preparation, detoxification, rehabilitation, and aftercare. So we start taking care of our client with the frame of the client base. We concern start from the preparation until aftercare. And Somchai concern about the services during 19. So we try to provide our quality of services. Finally, we would like to provide a quality of the services. In our session, we try to conclude about the substance abuse is a debilitating disease that can destroy life. We know. And the substance abuse continuum of care target to the problem that cause the abuse and provide tools to stay sober. This is very important message that I try to send to all of you, that we need the tools because to help us, although we cannot facing the client face to face, but we use the tools for monitoring and keep the follow-up cases. The substance abuse is a very serious disorder that can be treated, we know, with proper care and guidance and proper support. We need guidance. We need appropriate scenario in the prevention program, because the prevention program we concern school, family, community. So we have the client in diversity. The prevention curriculum should cover all of diversity. We concern the scenario in the chapter should provide most of the client and respect his culture also. So finally, I would like to thank you, Dr. Kim Johnson, Kerry Hopkins, Dr. James, and all of ICUDDR headquarters to support our region. And I would like to thank you, Department of Medical Services, Ministry of Public Health, Thailand. And I would like to thank you, the Office of Drug Abuse Prevention Treatment Department, Bangkok Metropolitan Administration, Thailand. And I would like to thank you very much to Dr. Bangan and Addiction Study staff team, Mahidol University, Thailand, to support our work. And sure, thank you, Mahidol University, to support this office, Asia Pacific ICUDDR. And this is the next session for the session break. All right, Dr. James?
Yes, thank you very much, Dr. Prapapun.